Hi there, I'm Corey. I'm one of the therapists here at Anchor Physical Therapy, and we just wanted to shoot a quick video to show you all what we're doing to keep not only our patients but also our staff safe during this COVID-19 pandemic. So let's come on up to the front door and we'll kind of show you the first stage here. You're going to notice that there's signs on the front door here that are requesting that if you have had a fever or experiencing cold and flu symptoms, you please go back to your car. Give us a call at the front desk so we can work out a plan for you, okay? If you're feeling all right and haven't been exposed, feel free to come on in. As you come into our front office, we have put a strip of tape down. We're asking that people maximize on this social distancing concept. So if there's someone at the counter, you wait behind the line until you're called up front. As you come up front, you'll see that we have a jar full of clean and sanitized pens here for signing in. And we ask that everybody go ahead and just take a little bit of what's now liquid gold of some liquid hand sanitizer and clean your hands for us. All right. Additionally, what we're doing is we're going through a questionnaire intake for all patients and taking their temperatures as well. Additionally to that, all staff, when they show up for their shift, is also going through the same questionnaire and also having their temperature taken. Anybody with a temperature that is over 100 degrees, we are having them go directly back to their car and call us on the phone so we can work out a plan for them as well. All right. Once you check in, one of our staff, as most of you are probably used to, one of our aides will come up to grab you to take you back and get you started on your warm-up. So come on back. You'll notice that we're wearing scrubs today, and we have made a change in our staff where everybody is wearing scrubs now. These are scrubs that stay on site. People change into the scrubs when they get here, so they're not bringing anything in from the outside environment. And then also they're taking the scrubs off, going back into their normal clothes, and leaving them here to be washed every night, so that we ensure that we're not only bringing anything in, but we're also not taking something home to our families. Okay. We do have hand sanitizer dispensers that have been installed around the clinic so that everybody can use those. And during your treatment sessions, everybody is going to be gloved up. So your aides and your therapists are going to be wearing nitrile gloves. We also have N95 respirator face masks that if any of us are within 6 feet of a patient, we are going to be wearing those masks to try to protect you. Unfortunately, at this time, with as hard as it is to get your hand on masks, we don't have any here for patients. But we do encourage you to bring in your own masks and wear anything that you feel comfortable with wearing during your treatment here, with the ultimate goal of trying to keep everybody as safe as possible, limiting their exposure, and also keeping our staff and their families safe and protected as well. As we go back into the gym, for those of you that are familiar with our gym layout, you're going to notice some changes. We've spaced out our treatment tables so that we can maximize on social distancing while we're working with patients and trying to do majority of our care out here in the gym rather than an enclosed room. But as many of you know, there are certain treatments we do that require a little more privacy, and so our treatment rooms are set up in the same fashion that they have been. However, we'll probably leave the door open, and again, we'll be gloved up and we'll be masked up during your treatment sessions. So we just want to make sure that everybody knows that we're taking every measure necessary to match with the CDC guidelines for how to manage an essential business during this time. And between each patient treatment, therapists are washing their hands with soap and water, antibacterial soap and water, and also the tables and all patient contact surfaces, including the equipment, is being wiped down by our aides, who have been doing an excellent job at keeping this place very, very clean for you. Point being, we're here to help you if you need the help. If you're having pain and you're having issues, we can be that source of relief for you. Right now, there's a lot of trepidation about going into some of the primary care health providers because they are seeing a lot of COVID-19 cases, even locally at some of our doctor's offices. You can come into physical therapy and have an evaluation done and get a plan put in place to help you start feeling better without having to go into your primary care doctor. So if you have any questions, I urge you to give us a call. Contact the clinic, talk to somebody, and let's work on your situation specifically and see what we can do for you to keep you healthy, happy, and moving during this crazy time.